Welcome back to Vbuzz with me, Ruben, and my co-host for today, of course, Swarna. And this is something that we often, not to say ignore, but we sort of take for granted because we don't realize the importance of it. But from the second you're awoken by your alarm in the morning to the moment you actually turn off the lights and head to bed, you're performing some sort of functional task with your hands. Right, so especially today in our internet-savvy and technology-ridden world, we spend a lot of time on our smartphones and other devices. But have you really stopped to think about how important it is to pay attention to your hands, especially when you have injuries or unexplainable aches and pains? Well, we have that discussion now with hand surgeon Dr. Ruben Sivanoli, who is one of the few in his field here in Malaysia. Hi, Dr. Ruben. Thank you so much for being here.
Thank you for having me.
Right.
Nice. Now, going back to the point about, how our world today is so technology-ridden, how have you personally seen the impact of that world on hand pathology?
Well, the thing about the devices that we use, whether it's handphones, laptops, tablets, even the desktop computers and all, it's basically how often we use it and how we abuse it in the sense that especially when you're on the computer for a long time and you're typing, especially those who are desktop related, that actually can lead to problems. But we don't see that often, honestly. But if you're concerned about using your handphones too much, I would not be too worried about it. But in terms of desktop computers and all, especially you're typing long hours, you're talking about 6 to 8, maybe even 10 hours on the computer a day. Not good for your hands.
Definitely doesn't sound very good either. But apart from typing, what are some of the other common repetitive strain injuries that you commonly see?
Right.
Well, actually, there's a wide range. We have most common, we call it the trigger finger, where the finger gets stuck and you cannot straighten it or bend it, and when you do that, it's very painful. So, simple tasks like you mentioned, from brushing your teeth, combing your hair, all become very, painful experience. And then only we realize how important our hands are, or how it affects our day-to-day activities, right? And other common problems that we may see is like carpal tunnel, where you have
the carpal tunnel syndrome, they call it, right?
That's right. And also swelling and pain over the wrist, which may be related to tendon swellings. We call it synovitis. That's called decoy veins. Those are the common ones that we see.
Are there any common causes though for all of these?
Well, it stems from abuse because in the sense that we use our hands for day-to-day activities. You don't have to be doing hard manual work for you to have these problems. Basically, you need to understand that your hand is conditioned to do a certain level of work. And if you push it beyond that level, it will complain. And if it does complain, do listen. But the problem is most of us, it's just something, then push it away.
Which is exactly what I did. I ignored it for a while, but then it came back, and then it went away. It came back again. The question is, if not looked into, for seriously, could there be like a long-term consequence?
Yes, of course. Any aches and pains is your body telling you something is not right. Whether it's your back or neck or whichever part, any joint that's causing pain and discomfort, there is an issue to be dealt with. And if you're not sure what the problem is, go and see a doctor. Or if it's hand-related, come and see us.
Going back to strain and how much is supposedly considered enough, or should I say too much strain for your hands? How much is...
Well, the thing is, in our lives, we do a lot of things. We, from time to time, you may want to take up a musical instrument. You may want to do a lot of writing. So we have to condition our hands to do what we want. Right? And when you say how much is too much, is basically you listen to your hands, right? And if it's starting to ache and hurt, then you have to address it in the sense that find out what is causing it. And once you do, then you have to do whatever is necessary, whether it's stretching, exercise, and all that to strengthen your grip. Then we make things better.
Some guitarists even go on until they bleed, Swan.
Yes, that's true. And drummers and cellists and all that. Everyone's got their own.
That's kind of common. It's becoming common in that sense.
And as Doctor was mentioning earlier, everybody who's in a different field has something that's characteristic with their hands.
That's right. Our hands also sort of define who we are, you know,
That's true.
whether you're someone working in the office or working in the factory, or someone who plays a lot of golf or whichever.
Yeah,
game.
golf,
Yeah.
guitar, yeah.
We never really think about it that way, do we? But you know, Doctor, we ran a story on our latest Buzz recently about children, and you know, sometimes, you know, accidents happen and they get their fingers sometimes crushed
Yeah.
indoors, and they end up living with lifelong implications. You know, what are your thoughts on that?
Well, any injury the body sustains, nature is such that it cannot repair itself 100%. You can never get it back to where it was.
Right.
But
Is it because of nerve damage specifically?
Well, the body is actually layers of tissue. We're
Right.
talking about bones, joint, ligaments, fat, nerves, tendons, and then skin. Like, for example, you get a cut, it doesn't go back to normal skin.
Yeah,
It never does. Yeah.
That's how it is. But even the quality of the skin with time, it will come back to almost 97, 98%.
Yeah.
You know? And same with the body, whatever injury you have, if it's gone beyond the stage where it cannot be, you know, sort of recovered, then it'll be a deformity, right? But if it can sort of repair itself, then you can get it to a functional state where, in the sense that you can get it to use, you know, basically use your hand the way you want it to be used.
Right.
You know?
Yeah.
And children, we've seen many, from nail bed injuries to you know, deep cuts to even amputations of the finger.
Right.
And most of the time it's related to that notorious door, you know.
Right, yeah.
And you know, children, they don't realize it when the doors are closing. Their hand may be just there at the time,
Yeah.
and it may be a car door, maybe a sliding door,
Yeah.
and you know, it causes all these kind of problems. And of course, we treat them the best that way we know. And the thing is, most of them, they live with it. And whether it's a cut or a deformity,
Yeah.
for them, it's life. You know, children are only told they're different by other people.
Exactly.
What their friends tell them in
Yeah.
school, their relatives may say, "Oh, your finger looks different." You know.
Yeah.
For them, they are normal. You
And
know,
they would-
even children are born with deformities
Yeah.
as well.
Yeah.
For them, they are normal.
Yeah.
It's this society telling them they're different.
Correct.
Exactly.
And we see children adapt very well.
Right.
And the thing is, they're just engineered to have fun and play. And that's what we like to encourage in them. And of course, you know, they do whatever it needs
Yeah.
to have fun.
But,
right?
but going back to, you know, what you mentioned about the crushed doors and you know, sometimes you don't feel it and you still have movement and everything, so you think that it's not something serious, right? But what sort of condition, you know, requires surgery?
Well, if trauma-related, if there is obvious deformity in the sense that your finger's looking bent or really swollen, please get it checked by a doctor, and then he may.
So those are the
do-
obvious ones, right?
That's right.
The ones that may not be so obvious?
May not be so obvious is sometimes you may have a simple cut, you think it's nothing, but
Yeah.
if your feelings are affected, that means your sensation and all
Right.
that, yes, it needs an operation where we have to reconnect the nerve that's you know, severed in
Right.
that sense, right?
Well, we were just talking about kids, but on the other spectrum, how do you think aging affects our hands?
Well, as I said, your hands define us, and we change, we evolve over time. And well, if we abuse our hands quite a bit, then we may tend to have these things like osteoarthritis of the joints. And well, at the end of the day is we want to see whether it affects your day-to-day activities. So I've had patients with very deformed hands, and still they're able to do what they want to do from
Right.
their, you know,
Yeah.
brushing their hair or putting on their clothes and all that, and it doesn't affect them that badly. So then we don't need to talk about surgery and, you know, doing procedures on them. But if they are, you know, in the sense that they are affected, that means they cannot do these activities, then surgery is required, like fusion or something.
Yeah.
But that doesn't mean that as we age, you know, we have to suffer. I don't think that's
Yeah.
the way it should go.
I
And
agree.
then
Yeah.
you were also mentioning before that there are a couple of preventive measures that we can take, certain exercises that we can do to maintain our hand health. Could you
right.
show us a couple,
Okay,
Doctor?
it's very simple. Basically, you want all your joints to be
Okay.
comfortable, right?
Right.
Not tight, right? And simple things like, you know, just stretching out like this, you know, and it may look very painful.
Yeah, it looks... Yeah.
For someone who's not doing it often,
Yeah,
I
yeah.
do this every day. In fact,
Right.
even when we're talking, you know,
It creates
it's-
flexibility to
that's
your...
right.
Yeah.
Okay.
And you must feel a bit of discomfort, not
Okay.
pain, right? So
Okay.
push to the point where you feel some discomfort. Then eventually you do this regularly, you find that it will actually increase with time. right? And the other simple things like just making sure your fingers are all stretched, pull back that way, right?
Right.
And of course, for your wrist to avoid carpal tunnel is just basically stretching
Right.
it this way,
Uh-huh.
right? And for the thumb. And don't forget, thumb is very important. It's 40% of your hand function as well.
Nice. So there's
Right,
just
right.
a couple of exercises that everybody
Yeah.
can do
Yeah, that's right. In fact,
simple stuff.
Yeah, it's actually simple stuff.
Right.
What about holding stress balls and stuff like that?
That's important in terms of
I
strengthening
mean,
your
squeezing
grip.
stress balls.
Yeah, that's
Sorry.
right. In terms of strengthening your grip, that's important. Yeah.
Yeah.
Right. Okay, so let's talk a little bit about opposable thumbs as well, right? Why are these so special, and how does it give humans an advantage in that sense? Because based on the research, I think that only humans and I think only one other animal
Primates,
category
yeah.
has opposable thumbs.
Well, basically, by definition, opposable thumb is being able to touch the other fingers, right?
Right.
And it helps us in ways that you don't really
Yeah.
realize, but simple things like holding your cup.
Yeah.
And grasping for items and all that, it's all because of your opposable thumb. So just try to imagine you didn't have a thumb and do all the activities that you're doing. You'll
Yeah,
find
not
a lot
happening.
of difficulty.
Yeah, I can't
Everything
imagine,
would fall. Yeah.
That's the thing.
Yeah.
So that's what sets us apart. Of course, some primates, as in chimpanzees and all
Right.
that, have that as well. So that sets us apart from all the different species that don't have that.
Right. I think
And-
koalas have it as well.
Yes.
if I'm not
Really?
mistaken. Yeah, koalas
Oh.
have
In
it.
terms
yeah.
of able to, yeah.
Yeah, well, we definitely can't live without our thumbs. But, surgeons say that if you ever were down to the wire, or if you had to choose, lose your index finger because it's the one that you need least.
Okay,
How
God
far would
forbid
you
that
say
is
that's
true.
true?
Yeah, obviously we
That's
don't hope that
true.
happens, but
I mean, yeah, of
If
course.
you had a
I'm just
choice.
saying- I was just saying, how
Yeah.
far would you say that's true?
Well, of course, we deal with these kind of situations where the fingers, in fact, multiple fingers, in fact, all fingers get detached. It does happen to some people, unfortunately. And of course, the priority is always the thumb, right? And then followed by your middle or ring finger. Why it's important is
Okay,
grasping.
right.
Yeah.
Grasping is a very basic task that the
Right.
hand does, right?
Right.
And for your index finger, it's not so needed in terms of holding things, and even writing also is not really required. But as I said, we've all been conditioned from the day we're born to use your hands. That how society dictates it to be, from holding your pen to other gestures and all that.
Right.
Right. So as I said,
Yeah.
the ring ring middle, and then your little finger, and then finally your index
Right.
will be in terms of how we reattach it.
Right, and it's
Right.
interesting to hear everything you're saying today, Doctor, because from what I know that hand doctors are actually a pretty rare cluster here in Malaysia itself.
true.
But tell us a little bit about how you ended up becoming a hand doctor.
Well, my interest in medicine, got me to doing orthopedics as a specialty. And then during my rotations, all the different types of subspecialties, because I put my 110% in each subspecialty
Yeah.
training time. And when being a hand surgeon, some of us are required to wear the magnification. I've seen the pictures of doctors with
Yeah.
big glasses in
Yeah.
front.
Yeah.
So that gives us a bigger advantage in magnifying what we see, right? So whatever I see on the table, the patient's hands, I'll be seeing it 4 times bigger.
Wow.
So imagine a 15-inch screen that everyone's used to. I'm seeing a 60-inch. So,
Right.
and then when we dissect, we can see very clearly all the different planes.
Yeah.
If you imagine the human body like kuih lapis,
Wow.
Oh my God, no, I don't want to imagine.
Everything, I can't imagine everything being magnified like that.
Yeah.
That's right. And then I'm just basically peeling off layer by layer.
Wow.
And our philosophy as a hand surgeon is being able to go in and out without being noticed.
Right.
So that you cause less trauma to the surrounding tissue. Recovery is faster, pain is less, and so many other advantages.
Yeah.
And hand, no other engineering tool can
Right.
mimic what the hand
Really?
does.
Right. Doctor, we've got one last myth-busting question, okay? So this is something that I think lots of people out there do, and I think some of us may be guilty of it as well. Is cracking our knuckles actually
Oh, yes.
really bad for us, or is it something that's acceptable?
Well, that's more of a myth in the sense that many people, especially the old folks, will say, "Oh, cracking knuckles will cause damage to your joint."
Right.
And there have actually been quite extensive,
I'm doing it as we speak.
extensive research done on that, and it proves that it does not cause
Yay.
damage.
Yeah, because it feels so good, doctor.
It
you know?
does.
It does.
It does.
It does.
Well,
I'm guilty of doing it as well.
nice. So now I can live life happily. Okay. Thank you so much, Doctor,
Right.
for joining us
Thank
on
you
the
so
show.
much,
Thank you
doctor.
for
Really
having me.
appreciate your time. All right, there you go. I was just going to ask him whether the Baptist snap, the thing that Daryl always does, slapping one finger to another, whether that's good for you or not. But
I don't think it really.
probably ask him after the show.
Okay. I don't think it makes that much of a difference, does it? Well, anyway, that was a really interesting conversation. I have never had a conversation about hands before.
Yeah,
so
I know.
that
It's
was
an
definitely-
uncommon career, but we're glad that we had Dr. Ruben to, tell us stuff that we should know.
For sure. Well,
All right.
don't go anywhere because right after the break, we are still in the medical mood. We will be chatting to dietitian Indra Balaratnam about child nutrition and
Yeah.
how to deal with picky eaters. Don't go anywhere.